Now, this towel can just stay there. Go ahead and turn onto your back. A place where a person's body is likely kind of the most revealed is in supine, right? So having an extra barrier over top for all sexes is usually one of the better suggestions I have in terms of maintaining modesty. So a little bit crooked. Get your arm back underneath the sheet. Go. See how just having that, you can navigate all of that. I didn't mean for that to be a point of demonstration, but that was pretty good. Sheets get tangled, and just try to cover a foot where you can. Then, always bolster. I know sometimes people are comfortable without the bolster under the knees, and there could be reasons in the future why you would want the knees at full extension, but you want to condition the bolstering into your routine so that you don't manage to forget it when you really don't want to forget it. All right. So a couple things there. I bolstered, and I was sure to pull the leg, holding the sheet against the medial thigh, and pull the leg further towards the edge of the table so I'm not reaching. I'm going to use my palms, fingers and hands directed towards the knee. There's a touch of an element of oscillation that can occur here. That's probably the only place I can think where I purposefully use my thumbs a little bit, just trying to kind of lightly lift the tissue as I oscillate. Now, for this area, I usually suggest working on a 45-degree angle, like you're looking at their opposite hip. That will naturally orient your arm and your hand away from the pelvis, and you'll always have an uphill. Just don't try to do this stuff. You can see how the hand is in a worse place here, but don't try to do this 1, 2, 3, or the other way. I start near the hip because that will orient itself better related to lymphatic fluid movement. So I start near the torso and then work my way to the periphery. So superior to inferior, or proximal to distal. They're all ways to kind of phrase that. So I've turned the leg in. Look at those toes. It's about 45 degrees of internal rotation. That's not too bad. It's what, at the very least, what we want. Then I turn the leg toward me, hold it there with this hand, and it's basically going to be the same set of applications, but now I'm more anterior rather than lateral. Holding the sheet against the inner knee, roll the person out, and then I can even get the anterior portion of the adductors. Going a little bit downhill, like don't let yourself slip, of course. But your quadriceps muscles cover, there's a medial section all the way over to a lateral section. But even here would be a way where you could, in supine, at least get some of the adductors. I just have to be careful I don't apply so much lotion that I slip. Right there, in a nutshell, is pretty much all you usually need to work on the quads, the anterior upper leg. For the hip flexors, which we had discussed the importance of those, it gets easier and easier to identify them. Like, I don't usually need my hands to do this. I just apply my forearm, I work over the sheet because the underwear is going to always be in the way anyway. So I apply my forearm and I start doing rhythmic compressions just like massage, work my way up, and then that's where I can palpate and identify where the anterior superior iliac spine is, that hook and or the greater trochanter. And I want to be inferior to the anterior superior iliac spine, ASIS, just below it, inferior, right there. That's where the hip flexors live. They attach right onto that hook. All these big bony projections and grooves, that's what they're there for. They're attachments, attachment sites. So if I can just find that here, then a passive way to really work on that and make this feel like more like massage is just above the knee, superior to the knee, rotate that hip. Everybody needs more internal hip rotation anyway. And I'm changing slightly where my forearm is from being really anterior to a bit more lateral. Going a little bit more lateral, like kind of going towards where a pocket is in pants. That's where you would get on the muscle that actually controls the tension of IT band, called tensor fascia lata, or TFL. That's how you'll see it used in an acronym a lot. Okay, bunch. Here. And the sheet, tug, bring them closer to the edge. Okay. 1, 2, 3, turn. 1, 2, 3. Turn. 1, 2, and 3. Done. Redrape. Start working lateral. Slowly go up. Identify where those hip flexors are. Compression, plus joint movement. So rhythmic rocking. A little bit more lateral. And good. Drape. Here. Here. Now right shoulder is the issue, so we're going to save that one. I come over. If I had a more kind of relaxing method for working here, even over the sheet, it's not too hard to identify the clavicles. So I find each of those. Let my fingers rest right there so I can feel them. Let the soft fist come over, and it turns into an asymmetrical cat paw. Now I can turn. Once I find this groove, I'll turn the hand over and switch. 1, 2, 3. Now I could do that, and that could be it if it's purely just a relaxation based. I certainly through that assessed there's something going on there. All right. Here. I want you to be just, I don't want to hit that. I want to be, see where this crazy hook, that's called the coracoid process. A muscle called pec minor attaches from there onto the ribs. So So you have pec major over top of that. So it's a case where, similar to being back here, I want to get 2 for 1. So my forearm needs to be here. It's a touch lateral, and I need to direct the force more onto the ribs. I have to avoid the clavicle, so that's where hand making contact, palm making contact with the table, should force your arm almost in the exact perfect orientation where you can't miss it. And then I can start incorporating movement. Here's where some elbow stuff will maybe cause some effects, just because the short head of the biceps does attach up there as well. If I wanted to go more extreme, I straighten the elbow, I grab underneath the elbow, and then I can lift the arm and pull towards me, and that'll really create the stretch. Muscle lunge techniques could lift the arm, ask the client to hold their arm up in the air, let gravity do the work. And slowly let go. Okay, lift up, lift up. Hold, big deep breath. And then slowly back down with the exhale. Now that's just a contract, relax, but usually works pretty good. Incorporated that one a ton. Then we cycle right here. This is where I can create a bend and a torsion effect without even doing kneading. I'm doing just a compression and then pulling the tissue under my hand. All the while reinforcing for that shoulder, remember what external rotation is. Remember that that exists. Forearms. On this one, because the extensors of the wrist and fingers are smaller, I tend to not use my forearm, I use my palm. But I stand in the same way. Wouldn't be wrong to use the forearm. I just tend to feel like, for me, this works good. But you can play with either or. Pulling that away from the elbow, incorporating some knees. It's more about creating that torsion. I could have done it like this, but instead I just grab, like that would be more of a traditional knee, which works good, but there's much more muscle on the half of the forearm closer to the elbow, so you're usually better suited to pay a little bit more attention there. Okay. Here's where shear forces for the metacarpals. So first and fifth, so thumb, pinky finger. Then second and fourth, and that means the third, which is in between, also got sheared. So I just did that. So it just looks like I'm doing this to the hand, but I'm being a bit more precise where my finger placement is. Then squeezes. And done. Round. Find their elbow. That'll lead you to their hand. Shaking. This is this potentially very valuable tool, an extra little thing that you can incorporate, especially for like the symptomatic area of the body and all that. Okay. Here. There's just doing this. This looks a little bit similar to like working on the hips and prone, right? Here, passively, can grab under the elbow. Externally rotate, so watch that wrist, the hand. pull up into abduction. Okay, go ahead and hold your arm up right there. Hold. Don't let me push you. Okay, good. Slowly back down. Okay, back up. Coming. Hold against me. Big deep breath. All the way out, nice and slow. Down, back down, back down. Okay, back up, lift, hold. Big deep breath. All the way in. And all the way out. And back down. And I just feel more freedom as I'm reaching that end point. It can be subtle, like it feels like to me like we started here and we got here. But that can feel like a lot of improvement to the client, I should say. Here, kind of doing a quick, if I can. Kind of that orientation, starting right by the elbow. And this would be a place where you can incorporate all that muscle energy stuff if the focus was more for the hands and wrist. Okay. Shear. Shear. That's better. Now in this routine, the hands got worked on twice, the palms in prone, and then the fingers, the rest of the hand in supine. The feet got worked on a little bit in prone, and then each foot got some individual work in sideline. So each foot actually got worked on 3 times. Here for the head and neck, take the pillow out. Now if you've done all that work in sideline, there is not a whole lot left to do here. One option is soft fists. If you're down on a knee, sometimes you have a better angle. It's a way where I could work a bit more on the upper trap area if I needed to. My go-to was showing you something that usually feels nice for a client. Is kind of just a mild traction here. Now, to start with longer hair, which he does not have, but you gotta learn how to get that hair out of the way. So you gotta learn to do kind of this cradle with one hand, draw and pull up. You can make this feel really good. Once the hair is fully out of the way and you're making just contact with as much of the neck as you can, then I'm going to set my hands like this and create a little wedge right there, and then I'm going to push my forearms against the table and lift the head, not pull, but lift, and that will create the tension, the traction. So see, elbows down, small lift, and don't force your way to try to make this all one big thing. Let yourself drop back down, come back up, further up, and again. You can create a mild traction in like 3 segments of the cervical area. Okay, further up, and a lift. Try to make sure their nose is oriented with their sternum. You can hold this for a good long time. It feels wonderful. And there. Squash your forehead. Make sure they have emotions. No anger, only surprise. No anger, only surprise. There you go. You do a little bit of stuff with the temples here if you needed to, but turn their head. I've already done all that in prone, so that's why I get to just focus here, here, do a few cycles of that, here, contact, contact,